Somewhere between a normal blood sugar reading and a type 2 diabetes diagnosis, there is a quiet, often overlooked stretch of years where the body is sending signals almost nobody is taught to notice. This stage is usually called prediabetes, and it affects a significant percentage of adults over 50, many of whom have no idea it's happening, because it typically produces no obvious symptoms at all. Here's what makes this stage so important. Unlike full type 2 diabetes, the changes happening during this window are often still highly responsive to lifestyle adjustments. And one specific, remarkably simple habit, something that takes less than 15 minutes and requires no special equipment, has been shown in a growing body of research to meaningfully blunt one of the most damaging patterns driving that progression: the blood sugar spike that follows eating. This video is going to walk through exactly what that habit is, the research behind why it works, and precisely how to do it correctly for maximum effect. But first, it's worth understanding what's actually happening inside the body after a meal, and why that specific window of time matters so much more than most people realize. Stay through this, because the exact timing of this habit, not just the habit itself, turns out to be the detail that determines how well it actually works. And it's a detail most people get wrong the first time they try it. What actually happens in the body. After eating, when food is eaten, particularly food containing carbohydrates, blood sugar rises as that food is broken down and glucose enters the bloodstream. In a well-functioning system, insulin manages this rise efficiently, moving glucose into cells for energy while keeping blood sugar within a relatively narrow, healthy range. But as insulin sensitivity declines, a gradual process that tends to accelerate with age, reduced muscle mass, and a more sedentary lifestyle, this process becomes less efficient. Blood sugar rises higher after meals and stays elevated for longer before returning to baseline. Over months and years, these repeated post-meal spikes are believed to play a significant role in the gradual progression from normal blood sugar regulation to prediabetes to full type 2 diabetes. This is a critical distinction that often gets lost in conversations about blood sugar. It's not just the average blood sugar level over time that matters. The size and frequency of these after-meal spikes appear to carry meaningful risk on their own, somewhat independent of the average, which means that a strategy specifically targeting those spikes, even without a complete overhaul of diet, has genuine potential to shift the broader trajectory. The habit: a short walk after eating. The habit itself is almost disarmingly simple. A walk, brisk enough to be more than a casual stroll, but not an intense workout, taken specifically in the window shortly after finishing a meal, rather than at some other point in the day. This is not a new or exotic idea. But what makes it worth highlighting specifically is the growing body of research examining exactly how effective this simple timing choice turns out to be, and why the mechanism behind it makes intuitive sense once explained. When muscles are actively working, they draw glucose from the bloodstream directly, largely independent of insulin, through a separate pathway activated by muscle contraction itself. This means that walking shortly after a meal, while blood sugar is actively rising from the food just eaten, gives the body an additional, immediate route to clear glucose from the bloodstream on top of whatever insulin is doing on its own. Several studies examining post-meal walking specifically, rather than exercise performed at other times of day, have found that this timing produces a measurably greater reduction in the size of the post-meal blood sugar spike compared to walking done well before or after eating, or compared to no walking at all. Some research in this area has found that even a short walk of 10 to 15 minutes, taken within roughly 30 minutes of finishing a meal, was associated with a meaningfully blunted glucose response compared to remaining seated for the same period. Why the timing matters more than the duration: this is the detail most people get wrong when they first hear about this habit. A 30-minute walk taken 2 hours after a meal, once blood sugar has already peaked and started declining on its own, does not appear to provide the same targeted benefit as a much shorter walk taken immediately after eating. While the spike is actively forming, the research consistently points to the same window. Walking within roughly 30 minutes of finishing a meal appears to have a substantially larger effect on blunting that specific meal's glucose spike than walking performed at other times, even when the total amount of walking is smaller. This doesn't mean exercise at other times of day isn't valuable. It clearly is, for a wide range of health outcomes, It simply means that for this particular purpose, targeting the post-meal window specifically produces a more concentrated benefit than the same amount of walking spread out or timed differently. For most men, this means the most efficient version of this habit isn't one long walk per day. It's several short walks, each time to follow a meal, a pattern that fits into daily life more easily than it might initially sound once the routine is established. How to actually build this habit: aim for 10 to 15 minutes, starting within 30 minutes of finishing eating. This is the window the research most consistently points to as producing a meaningful effect on the following spike. Keep the pace brisk, not casual. A gentle amble provides some benefit, but a pace noticeably faster than a leisurely stroll. Enough to raise breathing rate, slightly, appears to engage the muscle-driven glucose uptake pathway more effectively. Prioritize consistency after the largest meals first. For men not ready to build this habit around every meal immediately, starting with the largest meal of the day, often dinner, when many people are least likely to move afterward and most likely to sit for the rest of the evening, tends to produce the most noticeable initial benefit. Build it into an existing routine. Attaching the walk to something already happening, a short loop around the block right after clearing the dinner table, a walk to check the mail after lunch, tends to make the habit stick far more reliably than trying to remember it as an isolated task. Track how it feels, not just numbers. For men not currently monitoring blood sugar directly, simply noticing reduced post-meal sluggishness or that familiar heavy, foggy feeling after eating can serve as an early, encouraging signal that the habit is having an effect, even before any formal testing confirms it. A common misconception that undermines this habit. There's one misunderstanding worth addressing directly, because it causes many people to underestimate this habit before giving it a fair try. Because the walk is short and the pace is moderate, it's easy to assume it must be too mild to matter compared to a longer, more intense workout. But the research in this specific area isn't measuring overall fitness or calorie burn. It's measuring the glucose response to a specific meal, in a specific window of time and on that narrow measure. Timing and consistency appear to matter more than intensity or duration. In other words, this isn't meant to replace longer or more vigorous exercise, which offers its own well-established benefits for cardiovascular health, muscle strength, and overall metabolic function. It's a targeted, additional tool aimed specifically at the after-meal spike, one that happens to be effective precisely because it's so easy to repeat consistently, meal after meal, day after day, in a way that a longer workout routine often isn't. What this habit can and cannot do, it's worth being direct about the limits here. This single habit is not a substitute for a broader healthy lifestyle, and it is not a treatment for diagnosed type 2 diabetes on its own. For men already diagnosed with diabetes or prediabetes, this kind of habit should be discussed with a doctor and used alongside, not instead of any prescribed treatment plan, since blood sugar management in that context often involves additional factors a general lifestyle habit cannot address alone. What the research does support is that this specific, low-effort habit can meaningfully reduce the size of after-meal blood sugar spikes for many people, and that repeated over time, smaller spikes are generally considered a favorable pattern for long-term metabolic health. For men in the earlier, more reversible stages of blood sugar changes, the stage often called prediabetes, this kind of consistent, targeted intervention is exactly the type of change that research has associated with a meaningfully reduced likelihood of progressing to full type 2 diabetes, particularly when combined with other supportive habits like regular strength training and adequate sleep. This video is intended for general educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Anyone concerned about blood sugar, prediabetes, or diabetes should consult a qualified healthcare provider for proper testing and a personalized plan, and should never adjust or discontinue prescribed medication based on lifestyle changes alone without medical guidance. Sometimes the most effective health habits aren't the most complicated ones. They're the ones precise enough and simple enough to actually become routine. A short walk after a meal costs almost nothing and asks very little. And for many men, it may be one of the most efficient, evidence-supported changes available for protecting long-term metabolic health.